Brace face, metal mouth, jaws, pencil teeth. Kids can be really cruel. And back when we were growing up, braces were a pain, right? If they weren't hurting your mouth, there's a good chance they were hurting your popularity. But welcome to the 21st century. Braces have come a long way. And here for some straight talk about the latest teeth straightening technology as part of our My Family Tuesdays are Dr. Margot Brilliant, along with two of her patients, mother and daughter, Antonietta and Diana Emden. Welcome to the show, ladies.
Good morning. Thank you.
Now, we're so thrilled to have you here. Now, we're going to get to your personal stories in just a minute, but first, Dr. Brilliant, tell me a little bit about Invisalign, this new technology.
Invisalign is a set of clear aligners that straighten your teeth. You wear them about 22 hours a day. You get to take them out for 2 hours to eat and brush and floss. And they're almost totally invisible, so no one knows you're really wearing braces. And they're great for both teens and adults.
So that's exciting, especially for teens, because you don't have any of those name-calling things happen anymore.
Absolutely not anymore.
Now, Diana, you actually are using the Invisalign system, as are you, her mom. This is great. We actually have some before photos before you actually started using the treatment. Let's take a look at those. Now, just from those pictures, I can tell that both of you have come a long way, and you both have them in right now, right? And your smiles are so bright and beautiful. Now, Diana, I was just reading the other day, it's a study from the American Dental Association that says a quarter of all Americans are self-conscious about their smiles. And I know a lot of people that's probably true. There's probably more pressure even today than there was back when I was your age. What was it that made you want to do the invisible braces rather than, you know, the regular metal braces?
You can do anything with Invisaligns. You don't have to go through all those name callings. And they're comfortable, they're easy to use. You don't get food stuck in your teeth.
So it's easy when you're at the cafeteria, right, at school? What about, do you play sports or, you know, have gym class? Does it ever get in the way?
We do a lot of exercise. We run, we do weights, we do everything, and it doesn't get in the way at all. And if it ever does or bothers me, I can take it out really easy.
So it's pretty simple. And you can also, because they're removable, you can just brush your teeth like normal too.
Yeah.
There's no problem with that. Now, that's probably a really big selling point for parents because it's a health issue.
It is, and you used to see a lot of white spots around teeth when braces were removed because the food and the plaque got stuck around the bracket. And now with Invisalign, the patient takes the aligners out, brushes and flosses, brushes the aligners, and then puts them back in. You
don't have to worry about those. I know when I had braces on my bottom teeth, those threaders.
The floss threaders.
Yes.
They're very time consuming. Most patients don't floss because they are so time consuming. So again, with Invisalign, because it's removable, you have no problem with flossing.
Now, I know that when I got braces, I was 20. I got them on my bottom teeth, and I was thinking, you know, this is so weird because everybody else got them when they were 12, 13, 14, junior high, high school. And here you are, you're Diana's mom, and you decided to get them now. What helped you make that decision?
When I was her age, I wore braces, and I didn't have a good experience with braces. So I ended up not finishing my treatment. So when I took Diana to Dr. Brilliant, I find that Invisalign can be also for adults, and we talked about it, and they were right for me, so we worked out a very good arrangement.
I bet that's a really big plus if mothers and daughters, parents and children are doing this.
Right, because they can have their appointments at the same time. And the beautiful thing about Invisalign is you don't have to come as often. You go home with a series of aligners. So we can send patients home with 3, 4, 5 aligners. They wear them each one for about 2 weeks at a time. So their appointments could be spread out to be about every 6, 8, or even 10 weeks to the office.
Is there a way to know? I know with, you know, braces, your parents would know if you had your rubber bands in. They would know if you were doing things correctly. What about with these?
Well, there's a great product within the Invisalign Teen. There's a blue dot indicator, and it fades as the patient wears it. So if it's still very blue, when the patient comes back to your office, you know that the patient did not wear their aligners properly. So, yes, we have ways to find out.
Oh, that's great.
People are compliant.
This sounds so much better than regular braces.
It's got a lot of pluses.
I'm a new fan of this. Now, actually, when we come back, we're going to take you inside the orthodontist's office to show you just how simple it is to get fitted for Invisalign. Don't go away. Welcome back, everybody. This morning we're talking about the braces of the 21st century. They're removable and invisible, and they're custom fitted for each patient's teeth. Now, we've been talking to orthodontist Dr. Margot Brilliant. Earlier, we stopped by her office so she could show us exactly how the Invisalign fitting process works. Take a look.
In order to get started with the Invisalign process, we take impressions of your teeth that look like this. Along with digital photography and digital x-rays, we send that to Align Technology. There, they make a virtual model of your teeth. Let me show you what that looks like. So, this is the virtual model of the teeth that Invisalign fabricates from all the information we sent them. As you can see, these are Diana's upper teeth and her lower teeth, and this will show us how we map out her treatment over the next 9 to 12 months. You can see here that the upper teeth are moving back, the lower teeth are getting straight, and everything is happening simultaneously. The very cool thing about this technology is that Diana can download this to her home computer and actually watch her teeth move. She's very motivated because she can see how straight her teeth will be at the end of 9 to 12 months of treatment.
Now we're back here in our studio with Dr. Brilliant. Now this certainly seems pretty simple and pretty painless.
It is. The first appointment's very easy. We insert the aligners, give the patients their instructions, and then we send them home with 2, 3, 4 aligners in the beginning so they can change their aligners every 2 weeks, and then they come to see us and we check their progress.
And do you know when it's time to change, or is it just a set schedule you stick to?
It depends on the case. If it's a more difficult case, a more complex case, patients sometimes will wear the aligners longer than 2 weeks, but generally for most tooth movements, we can wear an aligner for about 2 weeks at 20 hours a day, 22 hours a day.
And you said that you send more than one set home with the patient when they come in, so that would be great for kids that might be in boarding school or people that are going on long vacations. They're not going to miss one of those awful wire tightenings that you have with regular braces.
No, their treatment progresses because they have their aligners with them. So they just change their trays, again, every 2 weeks, just like they were on their normal schedule.
Now, I've seen the pieces. We saw them on Diana earlier. Is this something that is usable for people with complex cases, though? Because they seem so simple.
Yes, Diana actually had a little bit more of a complex case.
Oh.
She had both baby teeth and permanent teeth when we started. And that's one of the great things about Teen Invisalign is that it's built in so that the permanent teeth can erupt into the proper place.
Now, it's a new technology or a newer technology. I know when people hear that word, that it's new, they're thinking, oh my gosh, this is going to cost a great deal. What are we looking at when we're talking cost?
Invisalign is actually very affordable. It's very similar to regular braces. Most people have payment plans, a down payment and a monthly payment. If someone has orthodontic insurance and it covers regular braces, it will cover Invisalign.
I know with regular braces, if the prom is coming up or homecoming or some big event, a wedding, a lot of parents end up having to pay to have their children's braces removed just for that event and then pay to put them back on. Here, you could just take it out, go to the event, come back.
Correct. It's a great time saver and financial savings also because you just take them out for a few hours and put them back in, and there's no loss of time, and you don't need to come back to the office. That's 2 extra appointments for really no reason.
What about if you're away and you all of a sudden need a set of the aligners? Is there something you can do?
Absolutely. We can mail someone their aligners because they know how to take care of them and wear them.
Where were you when I had those braces on my bottom teeth? This sounds like such a simple, easy system to do.
It is an easy system and it works very well, so we do enjoy it.
Thank you so much for being here.
Thank you very much for having me.
You're incredibly informative. I've loved having you.
Thank you.
Now, moms, if you are bracing for getting braces for your kids, check out InvisalignTeen.com to find a preferred provider in your area, or check them out on Facebook. You can also get more info for yourself if you're looking for a more perfect smile. And coming up next, our financial expert is back to give you some tips on getting you out of debt. Don't go anywhere.